What is being used here includes everything that contributes to the iterative beam hardening correction. And there is something called capping artifact. If we consider the X-ray tube and say that the X-ray beam is falling on, if I remember correctly, the area of the patient and the periphery area of the patient. As we previously mentioned, the least advanced technology in the area has been a topic of considerable discussion and analysis. This technology, which has not seen significant advancements over the years, plays a crucial role in the daily lives of the local population. Historically, the region has relied heavily on traditional methods, which, while effective in their time, have not kept pace with the rapid technological advancements seen in other parts of the world. For instance, while other regions have adopted cutting-edge innovations such as artificial intelligence and automation, this area continues to depend on, is everything okay? It starts, even if you want to measure the ROI or measure the Hounsfield unit, it should start with a low Hounsfield unit, even though part of this entire area is water, so it should ideally result in 0 plus or minus 4. You will find the part in the middle elevated. Well, this is the case if you are not using the Bodai filter. If we believe that the Bodai filter was effective, what would happen? We would say that we use a filter in this way. I'm sorry, I removed it like this. We said that the thickness of the center area is thin for me, while the thickness of the periphery area is large. This is to achieve equalization for the beam or X-ray beam intensity on your cross-section, or on the patient, or on all the patient sizes available. So in this case, what do? You make the beam going to the periphery the same as the beam going to the center, which is the same beam going to the other side of the periphery. According to what? You don't keep it the same. You provide an equivalent or suitable X-ray for the thickness that the periphery will encounter. So this area does not need a large X-ray, so I will use a low X-ray. But this area, no, it needs a high intensity X-ray, so I will increase the X-ray here. As for this area, no, it needs a low one. So you are doing equalization for the X-ray when you come to send this data to the detector, which does something called normalization. What is normalization? It means that I am now looking for where the highest pixel is and where the lowest pixel is. Then it starts to say, well, my highest pixel or highest intensity or highest signal reached its value like this, and the lowest signal reached its value like that. So my grayscale is in this range. My grayscale. In this range, if today you connect your signal in a uniform manner to your section that connects to the detector in a homogeneous or uniform way, then in this case, it will take your grayscale. The intensity values received here will be the same as here, and here, and here, and here, and here, and here, because you are essentially providing your incident X-ray equivalent to the thickness it will encounter. Therefore, the transmitted X-ray coming from your water phantom or this area or this cross-section will be equal. At this time, it will provide values regardless of whether this part is of higher thickness or lower thickness. Okay, good. In the mood. A Bodai filter is utilized, or even a regular filter, to remove soft X-rays and reduce the beam hardening effect that may occur in certain situations. They perform what is called calibration, stating that they will use a water phantom for calibration, which is a standard practice in imaging technology. The water phantom is used to calibrate the detector, allowing it to recognize that this is indeed the image of the water phantom. When you come to image the water, this particular phantom is placed directly within your field of view. There exists both a part located within the peripheral field of view and also a part situated at the center field of view. What it does essentially is teach the detector about the signal it will receive from various thicknesses present within the different sections of this specific type of water phantoms. It has data stored directly on its own internal system, the detector itself, and begins making automatic corrections based upon incoming information received later. In summary, the role of the biomedical engineer is to perform this calibration at the beginning of the machine's operation. If there is a problem with the image quality, or parts appearing in a certain way, they start performing water calibration or water phantom calibration to correct the readings received by the detector. They ensure that all detectors, whether in the periphery or in the center, such as the right periphery, center, or left periphery, are receiving the same signal with the same intensity and displaying the same house field unit on the existing image. There is something, the partial volume effect, which is well known. Involving the liver and lesions, you might scroll through the images, unsure if this is a focal lesion or due to the partial volume effect, requiring more info. You work and remain confused about whether this situation is legitimate or not, and you have to adjust in order to eliminate the effect of the partial volume effect so that you can see clearly. This honestly happens because you have your object or the lesion present and the intensity of its signal, which is transmitted in this scenario, it's not a complete signal. There's a part here, for example, in this area where there might be soft tissue. The signal that reaches the detector means that, for instance, this is at the detector, and this is another detector. If we assume that this area has air, then the image or the signal that will reach here will represent the signal in the color blue. While I have here a high dense object, it is supposed to appear here in white. While this detector cannot replicate from the second part of the air and the second part of 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 the second part, what is coming to him or the prism that is coming to him will result in either action or reduction, or in terms of the actual attenuation coming from the object itself when you have a focal lesion or abnormality surrounded by, for example, soft tissue such as muscle or fat or other low attenuating materials. Next to highly dense material like bone or metal, there is a difference in attenuation between these two lesions. The signals coming from them fall on the detector in such a way that what happens is that it starts to give you a signal that is in between. It is neither black nor bright, but rather something like a grayish color in the image output. This does not represent reality. It does not truly represent that there is a focal lesion. It appears better when you reduce the imaging parameters, such as exposure settings, to show the actual lesion size and determine whether it is a lesion or a partial volume effect. There is something incomplete projection. Incomplete projection means incomplete projection. It's the same idea as the partial volume effect that we are discussing. But the point is that if you have a certain object located at the periphery, for example, you are imaging the object, which is this blue one, from different angles, at an angle of 0 degrees. For example, in the angle, if a part of the object appears in the image or in the field of view you are taking, it is considered not completely included in your field of view. In the angle you are taking, which is 180 degrees, this part was out of your field of view. So what happens in this case? At that time, you did not capture complete data for that part. What happens is essentially similar to the idea of the partial volume effect, where this part shows an artifact. This artifact appears as we see, for example, in image A to image D. The margins of the object you have here are surrounded by artifacts. What causes this artifact is that the signal or transmitted photons that passed through it reached the detector and experienced averaging. Why? because, as I mentioned, this part is located on the peripheral field of view that was taken. In some projections, certain images may not be visible during the imaging process due to the use of a small field of view. For example, in this case, artifacts appear as a result of the averaging that occurs in the transmitted photons reaching the detector. Here is your object being imaged. There was no complete attenuation, meaning the X-ray photons that passed through only passed through part of this object and were not completely included within the field of view, giving you inaccurate data about its attenuation or the attenuation of this object. Consequently, the detector averages the existing signals, or makes an inaccurate estimation, leading to the appearance of artifacts in this manner. Okay, the photon artifact. This depends on the fact that you, for example, are currently capturing an image of the chest and abdomen, wearing something, for instance. Is that clear? Okay. During the imaging process, you set the milliampere, the value of the milliampere that is taken. It expresses a condition. However, it might encounter the shoulder area while it is working. The area that requires high milliampere corresponds to the chest, while the area that requires low milliampere corresponds to the abdomen, so it needs a little bit higher milliampere. After that, the pelvis requires even higher milliampere. This variation in milliampere occurs even though you are providing a fixed value of milliampere along your scan. Then, something called photon starvation artifact starts to happen, which appears like this and is very common, especially in the shoulder area, because you have a high density object here that prevents or causes high attenuation of the X-ray beam from reaching the soft tissues or the other organs present in the center of the image, resulting in a low number of photons. So, why is the number of photons important? When translated into a signal, it will tell you that this area has experienced higher attenuation, which is actually soft tissue. But the reason is that the number of incident X-ray photons that reached the soft tissue was low. Therefore, the transmitted number is also low, and the detector does not understand this. It just sees that the incident photons that reached here are very few. So, when it normalizes the data it received, it tells you that this area translates to white or gives you the whitening that you see. That's why you see the white artifact. This is a result of photon starvation. Today, this is addressed with something called an adaptive filter. The adaptive filter does the same thing I was talking about, which is the idea of looking at each pixel with an artifact and comparing it to the adjacent pixel's value, which is the correct one, and then it starts to make corrections to the values of these pixels and begins to smooth the image in this way after improving or removing the existing artifact. There is one solution to this, and there is another solution through adaptive filtering. Here, it expresses the number of photons coming into a specific region, and you start to see the noise present in this way. After using the adaptive filter, the noise starts to decrease, and a homogeneous value is established for the number of photons, meaning there is a more uniform distribution of photons across your image. In contrast, there were high and low values due to some pixels receiving an appropriate number of photons, while others did not. In this case, it translates to white spots and other areas where there is variation. The second solution is to use a technique we discussed, where there are two factors involved, and this changes the milliampere value. For example, when the system rotates, it starts to provide low MA in areas without high density objects, while in areas like the shoulder, it provides high MA. This is called transversal modulation, or along the z-axis. As it encounters the shoulder, it gives high intensity MA, and when it reaches the chest, it provides low MA, resulting in a curve that changes the milliampere values. The longitudinal approach with the filter addresses the photon starvation artifact. So either the filter is used or dose modulation techniques or milliampere modulation techniques are applied. There are also some artifacts that appear due to a condition called undersampling, which means you are not taking a complete projection. For example, we previously mentioned that I have an X-ray tube and an object, and you take images at a certain angle, which is called a projection. Then you rotate to take another angle, which is the second projection, and so on. If the number of projections you take is not many, when you perform data processing or image reconstruction, the undersampling effect, or the artifact we call the aliasing artifact, starts to appear. The aliasing artifact is very well known, especially if you are working on something with a small slide thickness and you are applying, for example, a charge filter or a boom filter. It starts to appear because you need high resolution at that time, and you need the image to show a lot of details with a thin thickness. So it doesn't have that data. This data is not captured due to undersampling. Therefore, the aliasing artifact starts to appear in the image. Regarding some related artifacts, we have talked about physics and the patient, and now we have the scanner. The most famous thing is the ring artifact. The ring artifact appears like this, or even in a regular CD image like this. I believe you all have seen it. The ring artifact is very well known because of what? I have the detector here, and here is the X-ray tube, and here is the detector. One of these detectors has a defect. It is not working. There is damage in one of the 1,000 detectors or 2,000 detectors that are present. So what happens? You start taking projections, and this area for you is not recorded. Then it starts taking new angles, and the AD detector becomes obsolete. So this part becomes not recorded. So in the end, when you rotate the prototype, it rotates in a shape around the organ, and you start to see this ring. This ring indicates that there is a malfunction, and that is why the ring appears this way. The ring can appear complete, or in parts of the scan, or in the scan where you are taking images around, and the table is stationary. That's why a complete ring may appear, or it may not be a complete ring. It may appear like this, not a full circle. Does anyone know why? Yes, may God bless you, doctor. This is the detector defect that occurred, or it might need calibration. It could have been damaged. Therefore, it will take a new projection, and the ring artifact that appeared in this form is the same situation with different projections. The ring or the detector has the same defect, and it keeps repeating, eventually creating the circular shape. Sometimes you see small rings, and sometimes large rings. This depends on the location of the detector. The detector's location relative to the row of detectors matters. If it is far away, for example, at the outer limit of the detector, then the ring will appear far away. But if it is in the center, the ring will appear in the middle. Sometimes some engineers suggest that they can change the module or move the detector from one place to another. It makes the autofield of view in your image show that there is no ring artifact. The ring artifact appears far outside the field of view in the black area that you can't see. So, they tell you that some companies do this to deceive the owners of the centers, especially if the device is still under warranty. So they don't have to change the detector or do any repairs, avoiding the need to get spare parts or replacements. There are some artifacts that are also related to the images, which are 5 millimeters and 3 millimeters. We always work with what is usually 1 millimeter and 1 millimeter with a low thickness. When you create a sagittal and coronal design, the images start to show up without artifacts. you see the existing artifacts. The artifacts are a result of you having created a large sagittal design. It's as if at that moment you are not capturing enough data. You are capturing a large amount, but there is data missing in between. You are working with 5 millimeters, but where is 1 millimeter? Where is 2 millimeters? Where is 3 millimeters? Where is 4 millimeters? That data is missing. If you take a slice of 5 millimeters, it shows you the front and back. But where is the data in between? No, you don't have it. When you cut through these sagittal and coronal planes, artifacts start to appear in the image. This is a result of helical reconstruction due to having incomplete data because you are performing reconstruction with a large scan size. This is a common issue that many radiographers encounter. For example, when you transform the image to coronal or sagittal, it appears this way because the volume may be set with a large scan size. You need to set the volume on NPR and multiplinary formatting, and then the artifact will start to appear. Sometimes this artifact shows up and remains present if you are working with a pixel size larger than 1, especially with organs that require high resolution like the patella or, for example, the ankle, wrist, and paranasal areas. These are the things you need to consider. If you process with a pixel size significantly larger than 1, the artifact will start to appear. You might ask, what about interpolation? Well, keep in mind that it doesn't improve. It just processes. The data present on the topic of interpolation means that when you take an image in this way, there is a part of the data that is fixed, which we can say is captured from a single point. So, what does this part do? This part performs interpolation. It starts to look at the part that comes after it and the part that comes before it, and it begins to estimate the values or enhance the image quality that exists. However, there is a significant difference between improving the smoothness of the image and the quality of the image. This image is smooth, but it lacks resolution. Sometimes you look at an image and feel that it is very smooth, but the image has no resolution. Here, you have limited yourself. Increasing the beach factor results in a loss of resolution, even if you have an image, even if there is interpolation. Even if you improve the image quality, you are making it smoother or improving the blurring effect that exists. But at the level of resolution, you have experienced a loss in resolution due to standing with a large beach factor. Well, this artifact often appears prominently in areas between, for example, bone and soft tissue, but here it might have a minor effect that is not significant. However, with bone and soft tissue, the effect is significant and very noticeable, especially in the areas with attenuation. So, what about the topic of the cone beam effect? In the past, they used Adelex rate Youb thin beam from off radiation and an ideal detector, like when you hold a laser pen and it emits a thin light. Then the topic evolved, and in this form, we are at the z-axis level. We know there are two dimensions. One is the x dimension, and the other is the thickness dimension, which is the z dimension where the patient lies down. This is the part that you spread over the patient or covers your area. The fan beam used to cover an area, but of course, when the beam is intensified, it takes on a cone shape. That's why you have the cone beam, which has its own issues. The problems that can occur with the cone beam are similar to the fan shape I was talking about, and the detector widens the beam a lot, creating a cone shape. There are some parts. I want to show you a picture of But if there is a specific area where you are imaging or taking different levels, for example, it is at 0 and at 180, then your z-axis is fine. If you image something like this is image A and this is image B. Both of these are the same phantom and the same thing is being imaged. But there is a difference due to something called cone beam artifact. This artifact appeared because of a material called Teflon. The Teflon created an artifact that appears around image A but is not present in image B, resulting from the Teflon part being imaged in image A by the outer detector. What does this mean? It means I have a part of Teflon located in this area, while in image B, it was located in the center here. What I want to say is that the cone beam presents me with a problem. What is the problem? It is that the objects located at the edges of the cone beam are problematic for me.